All right, I will start admitting people.
Recording in progress.
Hi, good afternoon, everyone. We're just going to give it a couple more minutes to let people sign on. And while we're waiting on them, if you all don't mind just dropping into the chat your name, where you're calling from, and one thing that you're hoping to get out of this webinar this afternoon. Okay, looks like we see Kathy here hoping to learn how to enroll in the marketplace. Awesome. Shanta hoping to get better understanding of marketplace enrollment process and benefits. Brittany says hoping to learn more information about how to better navigate the marketplace so she can assist others. Love it. All right. Well, I'm going to go ahead and kick this off. Thank you all so much. If there are others who are just joining, we would love for you to please say where you're calling from or where you're tuning in from in the chat, and maybe one thing you're hoping to learn from today's webinar. My name is Melissa Williams, and I am the Associate Director for Policy and Field Advocacy at National Patient Advocate Foundation. And we are really excited about this webinar, this fireside chat that we have today with our partners, Young Invincibles and Patient Advocate Foundation. You'll see we will be featuring Mina Schultz from Young Invincible and Erin Bradshaw from PAF, and we'll hopefully answer some of the questions that you all have. But before we get started, I just want to go over some quick housekeeping items. At the start of this call, you may have heard that we are recording this webinar. We're hoping to use this webinar as a tool for you all to share or to refer to later on as you're helping others possibly enroll or just for yourself. That said, we ask you all to please mute your lines unless you're called on. We invite you to enter any questions you have in the chat throughout the presentation today, and we will get to those questions as much as we can. And you are also welcome to raise your hand and we can call on you and you can ask your questions out loud. It also dawned on me that many of you are probably are just now learning about National Patient Advocate and Patient Advocate Foundation. So I just wanted to just have the slide here to quickly introduce our organizations if you are hearing about us for the first time. So National Patient Advocate Foundation is the advocacy affiliate of Patient Advocate Foundation. And Patient Advocate Foundation primarily serves limited resource patients and caregivers coping with complex or chronic conditions. Their direct services steer people to and through available safety net programs and other assistance, including enrolling in an insurance plan to make sure people can not suffer the, not suffer the financial or social distress that they may likely experience as a result of a diagnosis. And NPAF, as the advocacy affiliate, helps amplify the voices of patients and caregivers to improve how we all experience healthcare. And I really just wanted to set the stage before I turn it over to our speakers today. And having spoken with many of our volunteers, I know COVID is very much top of mind, and I just wanted to share this graphic. I don't know if a lot of you are like me, but I often have to check the New York Times website just to see where we are with COVID cases. And this is just a striking image to see that we've surpassed any waves that we've had previously. And I know many of you have shared just how scared you are, how worried you are for others, and ask what is it that you can do right now to help your community. And right now, with the context of Get Covered and open enrollment, we think one of the most important things that you can do is to help others get insurance if they don't currently have it. So we know that the Marketplace open enrollment and open enrollment program ends on January 15th. So that is next Saturday. And there are some important updates in this enrollment period that really make it easier and more affordable for people to get covered. And so at this time, I'm gonna turn it over to Mina Schultz with Young Invincibles, who is the ACA Outreach and Enrollment Program Manager. And I'm gonna allow her to sort of talk about what some of those new things are and kind of explain what they're doing to ramp up advocates to make sure that others get covered. So Mina, I'll turn it over to you.
Thank you so much, Melissa. Just bear with me while I do my screen share here. Slideshow, let me see. All right, everyone, how do I look?
Looks good.
Looks good. Okay. Awesome. Thank you. So hi, everybody. So glad to be here with you this evening. I'm so excited to see so many folks here on the line ready to discuss getting covered during open enrollment. As Melissa said, my name is Mina Schultz. I'm the ACA Outreach and Enrollment Program Manager at Young Invincibles. If you're not familiar with Young Invincibles, we are a national nonprofit. We work to uplift the voices of young people in the political process. But we don't just work with young people when we're talking about health coverage. We also lead the National Get Covered Coalition, which works with the outreach and enrollment community to help support their work and help everyone get covered. So today I'm going to share with you just kind of a high-level overview of how best to reach folks in this key last week of open enrollment. This might be the last chance for some people to get covered for all of 2022. So it's just so essential we ensure people know their options and have the tools they need to get covered right now. So starting with some good news, open enrollment has been extremely strong this year. As of December 15th, almost 14 million people have signed up for coverage. CMS, obviously December 15th was quite a few weeks ago now. CMS will be releasing new numbers this Monday. But given it's been about 3 weeks since the last numbers, we can bet that there's going to be some excellent numbers coming next week. So it's amazing to see so many people taking advantage of this opportunity to sign up for quality coverage. And we're excited to see that number keep climbing. So as Melissa alluded to, there's a lot to celebrate this year when it comes to signing up for coverage. Thanks to the American Rescue Plan, more people qualify for more financial help than ever before. So there are now extra expanded subsidies that mean quality plans are now available with very low monthly costs. And these savings are available to more people. So people who didn't previously qualify for any financial help can now find that they may be eligible. So that's an amazing step. We've been looking for increased financial help over the years. We finally got it with American Rescue Plan. Really excited that coverage is so affordable right now for people. And then I'm sure many of you know that the deadline to enroll has been extended. During the previous administration, open enrollment had been cut back to a month and a half, ending on December 15th. But now people have an additional month until January 15th to enroll in coverage at healthcare.gov and in many of the state-based marketplaces. And perhaps most importantly, the Navigator program has been expanded. So if you're not familiar with the Navigator program, these are free local experts that offer answers to your questions, help checking out your options, and help filling out the application and picking a plan. This year, the Navigator Program was awarded a historic amount of funding, more than it's ever been awarded before, meaning that more of this local help is now available for folks who have questions and need help signing up. And like I said, Navigator assistance is always free. It's unbiased. They are, grant funded, so they're not going to tell you to, buy this plan or use this insurer. They're just there to look out for you, make sure you understand all of your options, and help you choose the best plan for you. So what do we want to say about all this? So first and foremost, if you're uninsured, now is the time to get covered. Like I said, this may be people's only opportunity to get covered for 2022. So it's essential that people come onto the marketplace now and check out their options. Next, let's let people know just how affordable the plans are. We find that giving actual numbers and statistics and things like that actually help people understand better that they might be able to afford the plans. If you say something's affordable, what's affordable to me might not be affordable to you. So when you say to someone that 4 out of 5 people can find a plan for $10 a month or less, there's a pretty good chance that you're actually going to get that financial help. And then millions qualify for plans with no monthly premiums. This is thanks to, again, the American Rescue Plan, making premiums so much lower. And these are good plans. Many of them come with low cost sharing, like deductibles and copays. So even if you can get a $0 plan, it doesn't necessarily mean you're going to have a sky high deductible. There's actually good plans with low premiums right now. And like I mentioned, people who are newly eligible for financial help, they should go back and look again. They may have gone on last year and seen that there weren't any plans for them. They might have been too expensive, but things are different this year. It's a whole new world. And plans change every year. So even if you didn't see a plan last year that was right for you, you might find one this year. Of course, we want to push out the deadline, especially because it's new this year. Make sure people know that they have to enroll by January 15th. And also, we want to make sure people don't wait until the last minute. The marketplace can be very busy on the last day of open enrollment. So if you want to skip the virtual lines, enroll today. And then let people know that there's no reason to go it alone. We know that health insurance can be complicated, and we want people to work with their local assisters and navigators so that, you can save yourself the headache. It doesn't need to be complicated. Sit down with an assister and get some help. We actually have a website at yigetcoveredamerica.org where you can just pop in your zip code and find the assister closest to you. In some cases, you can even schedule an appointment with them. So definitely encourage you to check that out, either for yourself or for someone you know. So where should we be sharing these messages? Who should we be talking to? I think, a lot of you here are looking to see, how they can help people enroll and, who they should be helping to enroll. So, some of these depend on your connections within the community, but, there's never an opportunity too small to raise awareness. So, I think a lot of people have been doing social media recently, especially because of the pandemic and social distancing. People get a lot of information from social media. You can post to your personal account, or something that's really helpful is to post to community groups. So a lot of communities will have, local news websites or websites where the community comes together to discuss certain topics. Just pop some open enrollment information in there, and generally you'll get pretty good responses. So it's definitely worth trying. If you're comfortable, write an op-ed in your local newspaper. Local newspapers are actually, generally very eager for new content. So writing, just a little article about why it's important to get covered before the deadline. You could still get one of those out before the deadline next Saturday. So that's a great opportunity to get the word out. And then community groups and houses of faith are great places to share information. These are trusted messengers. People can rely on the information shared within these groups. So definitely consider, if you're at your house of worship, let people know about the options that are available. I actually know some people who have found their navigators that way. So it's a great way to connect with people who may need assistance. COVID testing and vaccination sites are great places to find uninsured folks who might be interested in learning about their options. Local schools, from primary to higher education, are often very welcoming of this type of information because their students benefit from having access to healthcare. But really the key to all of this is word of mouth. This continues to be the best way to get people the tools they need to get covered, whether it's just, planting the seed of checking their options or actually helping them fill out an application. So, while these methods can be effective, so too can just simply telling people you never know. Your neighbor's uncle might have lost his job recently and be uninsured. So basically just tell people. This is a bit of a text heavy slide. I apologize. I had a lot of ideas here. We've really gone through the first two already, that coverage is in fact more affordable now and that people should look again if they didn't find the best plan for them last year. But, as Melissa said, the pandemic is ongoing. Having access to healthcare is more important than it ever has been. And because of the pandemic, people's situations are in flux. A lot of people have lost work. A lot of people are uncertain about their situations, what's going to happen in the coming year. Many people are, of course, anticipating going back to work this year. So, getting coverage through a new job might be a possibility for them. But really, there's no need to wait until you go back to work. We know that it's important to get covered and stay covered, whenever you possibly can be. So marketplace coverage can be dropped at any time. So people they can sign up now and have that coverage for as long as they need, and then make the switch to employer coverage when the time comes. So it's super easy to make that switch. So, why not get covered now and then change later? There's no reason to wait. And it's important for people with pre-existing conditions to know that they're still protected. There's still some misconceptions out there that those protections have been repealed, and they have not. Marketplace plans cannot deny you coverage or charge you more based on your health status and history. It's simply against the law for those plans to do that. So that is not something that people with pre-existing conditions need to worry about when they're shopping on the marketplace. And then lastly, if you're a qualifying immigrant and you're uninsured, now is the time to sign up. Enrolling in marketplace coverage will not impact your immigration status. Okay, and just to close out, I wanted to share some resources with you all to kind of help you through the end of open enrollment and throughout the year. First, I would like to invite you all to join the National Get Covered Coalition. This is a network of over 600 members who work and volunteer in the outreach and enrollment space. It's free to join. It gets you access to outreach and enrollment updates, materials, webinars, support, and monthly coalition calls. So please reach out to me if you'd like more information or if you're interested in joining. We'd love to have you. Ongoing through open enrollment, YI is providing our Open Enrollment 9 toolkit, graphics, social media messaging, and all kinds of content for those who are doing outreach and enrollment. And in addition to those materials, we're also in the middle of our annual texting campaign. So this is a fun and easy way to do outreach to those who may be in need of help learning about their options. We provide scripted responses, so you don't need to be an expert to participate. And again, please reach out to me if you're interested in volunteering. It's a really great experience. We get a lot of really nice feedback from the folks that we contact. And again, it's just an easy way to volunteer your time to getting people covered. And then lastly, I would like to invite everyone here to join YI and our partners tomorrow for National Youth Enrollment Day. This is our annual day of action where we focus our outreach efforts on ensuring that young people have the tools that they need to understand their options and get covered. This year's theme is New Year, New Healthcare, and we'll be celebrating all of these new ways that people can access financial help and enrollment help to get covered. So we'll be celebrating navigators, we'll be celebrating new financial help, and making sure people know about those great new resources to them and getting covered. We've got a toolkit ready for that with sample social media, graphics, GIFs, videos, and everything we need to help you post to social media tomorrow and amplify these important messages. So we hope that you will join us for that. Okay, that's it for me. I just, again, I'm so glad that you're here and for your commitment to getting your communities covered. This is really important work. It's not always easy. And it's just, Young Invincibles really appreciate you being here for this great event today. Of course, a huge thank you to National Patient Advocate Foundation and Patient Advocate Foundation for inviting us today. And any questions or comments are welcome. And thank you so much. Don't hesitate to reach out if you need anything.
Thank you so much, Mina. That was wonderful. I know some people may be wondering whether or not they can get copies to your slides, and I believe we can provide copies, right, Mina? I think it's just filled with a wealth of information and really great talking points to connecting with your community and telling them the reasons why they should get covered if they don't have insurance already. One question I had for you, Mina, I was looking at some of the reasons why people, decided to tune in this afternoon, and some had mentioned, any challenging scenarios about signing up in the marketplace. And I know we've talked about some of the things to be celebrated right now with, plans that are more affordable, the longer enrollment period, the more navigators. Are there still challenging scenarios right now when enrolling in or signing up on healthcare.gov?
Sure. I think one of the big challenges that's newer because of the pandemic is part of the application is trying to estimate your income for the coming year. So a lot of this financial help is based on what your income looks like. The less you expect to earn, the more financial help you get. And that's projected income. So when we're talking about estimating our income, it's not what we made last year, it's what we're planning on making this year in 2022. And for a lot of people, that's just really hard to do right now. People just don't know what they're making. Even, they might be working different hours. They might be looking for work and not know if they're going to go back to work. And there's no real easy solution other than knowing it's your best estimate and you can change your estimate at any time during the year. So make your best estimate now. If something changes, go back into your application and update it. But really, I'm going to point people to navigators again because they're the experts on this. They know how to do it. They've been doing it for a long time. And they have really learned through the course of the pandemic how best to do that. So I think that's one of the probably biggest challenges right now when you're filling out the application.
Thank you for letting us know. That's incredibly helpful. And I can, I think it's also, most people are used to reporting their income from the previous year, right? Never really projecting. And I think it's just a really helpful tip that you mentioned that here. So thank you so much. Another question I have is related to the special enrollment period that took place last year. If people are like, well, what, I signed up during the special enrollment period, do I need to sign up again? What are your answers to that?
So when you signed up, say you signed up during the special enrollment period in July, your plan year still ended December 31st. People who were enrolled last year, if you don't take action, you'll be auto-enrolled into the same or a similar plan for 2022. So you're not going to be dropped from your coverage if you didn't do anything. But if you go back into your account and kind of shop around a little bit, it's worth it to do that because you might find something better for this year. So you don't have to do anything, but it's definitely in your best interest to just go in and look around, make sure everything's up to date, and just check things out before you settle for 2022.
Thank you, Mina. And people, let me see, I'm just double checking the chat to see if there are other questions. I'm not seeing any, but you all are welcome to still enter questions throughout the webinar today. At this time, Mina, I'm just going to thank you for sharing this wonderful resource that everything, the toolkit, all of that Young Invincibles is doing for Get Covered and open enrollment. You all are awesome. We will share these resources with you all, so you have them, don't worry. I also just want to make a plug for NPAF's ACA plan guide. We do have a plan guide, a resource that is on our website. We'll be sharing that with you later on in the webinar, but many of you had mentioned in the chat if there are, what are ways to help you make the best decisions as it in terms of enrolling in insurance, and our plan guide is a great resource to help in that regard. So we'll be sharing that link a little later, but now I'm gonna pull up my my deck. And we're just going to turn it over to the fireside chat here that we have planned with our colleague, Erin Bradshaw with Patient Advocate Foundation, and she is the Chief of Mission Delivery there, and she has been with Patient Advocate Foundation for over 20 years and really has some amazing insights that she can share just from her experience of having worked with patients and understanding the importance of having insurance. And so I'm going to now turn it over to Erin, or invite Erin to turn on her video if she has not already. And we will, let me see here, just trying to work out the tech.
I can see myself.
You can see yourself. Okay, awesome. All right. Well, great. And I am going to just stop sharing my screen. Because we won't be sharing slides for this portion of the presentation today. So I just wanted to say, Erin, thank you so much for joining us. We have already touched on, open enrollment, the ACA marketplace right now, but I wanted to just back up just a little bit we have advocates joining us today. We have people who want to maybe just sign up for themselves, but what can you say about why it's important to have insurance from your role, having worked at Patient Advocate Foundation?
It's really an important part of your financial planning. It's a protection that exist. So we hope that you don't have to use it just like you would to look at a car insurance plan. But it is such an important plan to carry because you can't predict the future. If you are someone who has a health condition, it has even more emphasis on why it is important. It gives you access to the needed care that you have. It oftentimes will create less burden or hinder to getting access to the necessary doctors, medications, and treatments. And then it also is a financial protection. There are caps that are established that at any point, if you were to have a major life crisis, that you know that there is a limit to the financial impact to your life. So, medical bankruptcy is known to be a very is very high in the medical debt scenario, and it ruins people's credit and it impacts their livelihood too. And so I think really where it comes down to is a lot of people are in misunderstanding that they might not have eligibility, they might not be able to afford it. And so a lot of education has to be shared, and understanding that individual circumstance, what it is today, could be different what it was, as well as just, I feel, storytelling, examples of, something that you've experienced or could talk about, from a simple fall to a life-altering health condition, and really the impact to the family. And then also show them what options are available to you now. Let's look at the plans. Let's kind of assess, what financial impact that might have to you, and then kind of talk about the pros and cons of that. I will say, insurance isn't all created equal. And I think the other part that I just want to put some emphasis around is just because there's an insurance product doesn't always mean that it is equal to the protections that you think, and you really should be ensuring that it is falling under the Affordable Care Act's protections, and that you have a a plan that is truly a major medical plan, and you understand other short-term indemnity, accident only plans, travel plans, they have different eligibility guidelines. They're a false sense of protection. So that too. So I think it's coupled together, not only needing it, but also understanding what plans there are, and also recognizing that insurance can be considered a federal entitlement, like a Medicaid or a Medicare, and it can be a purchased plan through an employer, individual market, the marketplace. So you have lots of different options. And so that too, like assess it and see what you have, and you'd be surprised. Like,
Thank you, Erin. I think that's just really incredible information that you've just shared. And one of the things that we really emphasize during our Get Covered campaign, or this broader Get Covered campaign, is that this is the time to really do what we have been phrasing as a healthcare audit, like making sure that, the doctors that you see are in your insurance network, that the medications that you're taking are part of the formulary that is within your insurance plan. And so some of these checks that people may not necessarily think about because they're just like, oh, I have insurance. But sometimes they don't realize that it's not fully covered, right? And so one of the things, one question I had, as well as if you could say a little bit more about the work that's done at PAF and how case managers help patients enroll in insurance.
Sure. Our case management team is really the heart of Patient Advocate Foundation. They're the whole reason why we founded the mission in the organization, and they're the true MVPs. They are the individuals that are really assessing your situation and identifying, what best course of action needs to be had. And so I will say that because our organization not only touches on the importance of insurance and eligibility and enrollment, but all of the other factors that play into that. So if there are concerns around the financial ability to afford, or some of those forthcoming expenses like deductibles, copays, and the ability to maintain the insurance, we really need to assess that collectively, because we need to know what steps we need to take as a whole in order to be and to help that individual. And so that's where I feel, Patient Advocate Foundation has a unique perspective and support to somebody who's really navigating the system, because we are listening and then helping you navigate that. And so really what our goal is to just what is it that you have available to you? We mentioned this before, but that's such an important piece, because we don't want to jump into just marketplace right away, because if you have another option, we want to certainly assess that. And if you had an employer-based plan, for instance, you may not qualify for some of those financial subsidies we were talking about, because you have other coverage. So that's why it's important. So as we kind of go through the checklist and understand what has happened in your particular situation, and we land on where we need to go next, then we go to that and we want to start looking at the eligibility of that. So hopefully we're talking right now and we're in the open enrollment period. And so we're going to go right into assessing you as an individual, your location, your needs, what are your current health conditions, what are some of the treatments, preferred doctors, medications that you're on, even projected, and then understand your budget, your financial abilities, your household size. Like we might be talking to you, but maybe you have a larger family that we need to be evaluating also to ensure that there's coverage there. And that can be very, that's customized. If you have children, maybe there's they qualify for Medicaid, but you don't, or in that element. And so then as we kind of walk through those pieces, then we're going to evaluate the top plans that are available to you and help you understand the full financial impact. So what would be the premiums? What are some of the financial support that you might get from some of the things that were spoken before, as well as, deductibles, co-pays, networks, major out-of-pocket maximums, because ultimately what you need to understand is that it's not just the premium, it's the full package. And so we want to do that. And then we're going to look at you. And if you tell us that you have a specific health condition and the financial issues are still present, maybe there's a national charity, maybe there's an organization that helps financially around premiums or co-pays and things of that too. So it's there's not always an option for everyone in those scenarios. And that's why we have to really kind of just take your specific situation and assess it and go down that road. We aren't going to tell you which plan is best for you. What we're going to do is lead you and help you understand and provide that guidance that is so important to ensuring that you do have the best protections available to you, and then help you understand if you choose an HMO versus a PPO, what does that mean for you, and whether that's an important variance. And if you'd like us to help you apply, we can walk you through the online application. Some people prefer just to have this conversation and kind of assess, and we send it to you in an email, and then you talk to one of the many navigators that are out there that this is what they do day in and day out, and those pieces. So again, it's just an opportunity to have a third party to kind of lead you, because we recognize that even having health insurance, don't ever assume that the plan that you have is still the best plan to keep. And that is a big takeaway as well. Formularies change, networks change, plans simply change. And then there might have been something that's newer. And we touched on this earlier. There's a lot more options and there's a lot more elements there today. And there's Medicaid. Medicaid has some expanded in some states. Not all of them are assessed for Medicaid. So you want to make sure you understand where the state you're in, so that you're evaluating and which way you might want to go down and doing an application for, because those types of pieces. So it's I wish to say that there was like a really easy pathway for it, but I think the most important takeaway that I would have to you is there's a lot of preparation that can really set you up to make the strongest decision if you just start from the beginning and just write down what's important to you. And if there are known treatment regimens, medications, providers, networks that are very important to you, that you can match against those types of things, because that will start to narrow down your selections, and then we'll compare it against those financial pieces.
I think that's a really great segue to the next question I have, which is around like what recommendations would you give to people who may be overwhelmed with what plan to select? And what I'm hearing is, making just that really thoughtful list of like what's important to you, and starting there maybe is probably that good place to start for, I guess, determining what might be the best options. I don't know if you have more to add to that.
Yeah, right. So to build off of that, so we talked about which plans are available to you, important to evaluate your family history, as well as potential health concerns and current concerns, and the design of your plan. So like if you like the flexibility of going and selecting your own provider and not having to get a referral, kind of evaluating that against the cost to that too as well. But also the personal finances and budgeting. This is a reality, and we need to recognize that if you're not able to maintain it or pick a plan, or you pick a plan based on something that you end up finding yourself unable to follow those networks, then you really aren't in a real great financial situation, because you might find yourself not getting the coverage that you anticipated. But I think that those keys are, even during the assessment that we're talking today, if there is a situation or a change that happens at any point during the course of your year, to go back and reassess. And we also talked about that before too, because if your financial situation changes, or there's a situation which they call a special enrollment period, and those can give you opportunities too, and you might be aging into a Medicare plan. So, I think the part about it is referencing some of the resources that were shared by National Patient Advocate Foundation, and there's a great asset there. It will actually lead you down a lot of these questions. So you don't have to know and remember what we're saying today, because we are trained advocates and we've been doing this type of work for 25 years. And it's more natural for us. We're also, a slightly removed as a third party, so we can kind of have that knowledgeable mindset and education. I would just encourage you that as you continue to work through this exercise and it become new, that continue to educate and familiarize yourself and join webinars like this and listen to educational sessions and ask questions, because as an educated consumer, ultimately, that is how you can use your plan to the best of its ability, and you will get the most impact and the least financial challenges, simply based on a lack of understanding and using an out-of-network, for example. And so those are key elements, I would say. And remember, pharmacy benefits and medical benefits are often different. And so if you have a desire to use a brick and mortar particular pharmacy, you want to understand all of that, generic versus brand, if that's important to you, and look at those things very clearly, formularies, as well as any restriction around the types of medications that you might be able to access to, because that's often forgotten as you're looking at the overarching element. And pay attention to any kind of exclusions and elements around like those pieces, because if there's something for certain that is important to you, you want to look and establish that. So.
Thank you, Erin. That is really, really helpful and some great tips there. I see one question from Monique came in through the chat, and she asks, with Medicare or Medicaid as a primary plan, can the marketplace still be used to find a supplemental plan?
No, you really need to be Medicaid. Traditionally, you don't find a supplement. I mean, if you have an employer-based plan, whether that's your spouse, yourself, because expanded, you could find yourself in that scenario. It's really unlikely. So usually Medicaid pretty much covers your care that you need. You are in a state-based plan, so you tend to be getting treated in the area that accepts that. With Medicare, I will just put an emphasis on this. When you become Medicare eligible, it is really important to understand the supplemental insurance options that are available to you. When you turn of age, you have a very small window in which you can elect a plan that does not enforce a pre-existing clause. And so that really is something that is, I think, lost often. And, a Medicare Advantage is not a supplemental plan. It is truly, a complement to and offers some added benefits, but a supplemental plan really acts just like we're talking. It is to cover those co-insurances and those out-of-pocket expenses associated to what the Medicare does not pay. If you're disabled and following a Medicare, that is not as clean. It is dependent on the state and the laws that are in play and whether or not they also extend that to you. But it becomes eligible again as you turn 60 when you become Medicare age. So because that could be different based on if you're still working. But I would just really, really put some emphasis on that, because if you have a health condition or you just want to make sure, just like we're talking about the safety net and this financial security of, having these benefits, pay attention to that and do your due diligence, because if you have any health condition at all, you are subject to a pre-existing clause, and you may or may not be able to get a plan. Again, that is state by state regulated, so I can't talk about that, but it's just something we see very, very often. And be certain to also pick A, B, and D. And that's D is your prescription, A and B. A is your hospitalization, B is your outpatient. And even if you're employed and they give you an option to not elect A, or B, B, I still suggest that you do. I've seen a lot of people who don't, and then there's a financial concern, and there's some elements around penalties and things to that nature too. So again, we have a lot of educational materials on Patient Advocate Foundation's website. There's a ton of information our advocates can also support you with. but I'm sorry to say that Marketplace is not one for those.
Thank you for elaborating on that, Erin. And I also just want to put a plug for a webinar we did last month, just before the holidays, very similar to this conversation here that we're having about ACA, but we had it for Medicare. And it actually featured Tony Sowery, who's a Medicare counselor, and Nicole Bradshaw, who has just together both have a wealth of knowledge about Medicare. And so we urge you to check that out as well. That link is on our website. The other question, and this may be the last one, just depending on time, Erin, but you kind of touched on this earlier about how people, when they think about their out-of-pocket costs, they really, only think about, maybe just the premiums, or, they focus on one bit and don't really think of all of the different cost sharing elements that are involved. What advice would you have for our volunteers to help, as they're talking to people in their communities, to get them to say, like, this is the bigger picture. This is why you need to care about, not just your premium, but your deductible and the copays and how it all adds up. What would you say to that?
I personally feel like showing actually is the best way to explain it. We, as advocates, and especially Patient Advocate Foundation, we touch an audience that has been impacted by a critical or chronic illness. So we are dealing with individuals that are in a really dire need for medical care, and oftentimes very high expense associated to it. And so it's not uncommon for us to get a lot of phone calls around medical debt and the financial need for things and the shift in their ability to work. And so when we often are, evaluating the scenario, sometimes, well, not sometimes, a lot of times what we're being told is, I didn't know, I bought this plan because I could afford the premium. And then they find out that they have an $8,000 deductible and a 20% coinsurance up to, even higher out-of-pocket maximum, and might have not understood that they had a potential health and savings account option that they could have contributed to. Regardless, if you understand the full financial impact, you can become a little more prepared as a consumer and hopefully budget against that so that you can put some funds away, or at the minimum, just understand that this would be what you're coming up against to that. And so when we're talking about plans, we're talking about the financial part. That is why we have these conversations. And then you couple it with what is important to them. Because a cheaper plan that keeps you in a narrow network, and that is something you don't want to do, and you go out of network, then you are ultimately putting yourself in a situation where you really don't have coverage at all, or your out-of-pocket responsibility is so significant that it really would have been better if you had just chosen a plan knowing that that was something that you are. So I think a lot of these things are lessons learned, and that's why stories are so important to share and to talk about and give examples and see how they feel, because it may not have been something that was important, but maybe the course of their care and their disease being the way it was, it becomes one. And so then we talk about open enrollment and all these times. And so now we're going to reevaluate, and let's look at that. So and that's why these conversations need to continue to happen. So even though today we're giving you this guidance and we're telling you that there's organizations like ourselves, there are advocates nationwide that are here to help you, really assess with that. And if you don't feel comfortable with the guidance that you're given, seek other, just like we say, seek a second opinion for your treatment and your diagnosis, do the same thing. Same thing goes with any kind of insurance agent, a broker, an advocate. Everyone has the right to multiple choices and understanding. So I know that it is really challenging sometimes and feels overwhelming, which is why we're talking about it today and why we want really put some emphasis around start investigating if you haven't already before the deadline, because you might make a decision because you're trying to do something rather quick, or you might not get the help that you're hoping for because of the volume. So the more due diligence that you can do, the better.
Good tip, Erin. Thank you. And I do see one question that came in, and I think we may have some time just to address that here. And I actually don't know too much about this. And the question is from Lynn. She asked, what do you all think of an out-of-pocket protection plan supplement? I know that might be more specific for different individual circumstances, situations, but I'm wondering if you know any more about it, Erin, that you can talk a little bit about it.
I think we're talking about, so there are some, disease specific plans, accident plans, indemnity. There's certain plans that you can purchase that will pay you a set amount of, for confinement into a hospital so I'll watch the chat to make sure that I'm kind of falling on that. I think it's really a personal decision. It's, it is something that like I have a couple of those myself. I have a son who's in sports and he hurt himself, playing sports, and it ended up being a benefit for me because he had an injury and I was able to submit that and it helped towards my high deductible plan. So, but again, I think you got to assess your financial ability to do it, understand exactly what it is. And it definitely is not an insurance replacement. And you have to remember you have it. So if you're looking at these things too, that you also, there's some paperwork behind that, and there's some pieces and parts that you have to do in order to assess that benefit. Yeah, so I see it now. So yeah, it's truly it's a plan that if a health crisis were to happen in this scenario, hospitalization, they would pay you X amount of dollars based on that. Read the fine print, understand what it is. Some of them do have pre-existing elements to them. Also, how often is there kind of a, I would not want you to have several situations, but if you were, like, is there a cap of how much they'll pay? If you're kind of assessing those types of things and what you're paying for it, and if it's a safety net, I can't tell you one way or the other, but I think it's a circumstance of personal choice.
Thank you, Erin. And let me see. And I think we do have a little bit more time because I know we are done at the top of the hour. Let's see, there is a question of how can I select a plan that's best for me? And I think that again, goes back to that sort of individual situation where maybe you have to weigh in, what's really important to you, and really maybe having a conversation with a navigator to talk that through, right, Erin?
Yes. Which plan is best for them?
Mm-hmm.
Yeah. Sometimes you're narrowed and you might only have one or two options. And so you might not have a choice. But when you have a choice, I always suggest doing a comparison chart of the variables
Mm-hmm.
when you're trying to really assess the differences, and and then comparing it to what the factors that are most important to you, and that's the easiest way. And if there's something you don't understand, you can also call those plans and you can talk to them and ask them. They have a call center oftentimes pretty much open all the time to kind of give you that guidance. And so if there's something that you can't see, or if you can't tell if there's a particular medication on formulary and you want to ask the question, they should be able to tell you that thing. So.
All right. Erin, well, thank you. And I think we have just about 5 minutes left. And so if there are other questions, we will respond to them in follow-up. I just want to take the time now to thank our wonderful speakers, our guests, Erin and Mina. Thank you again so much for helping us make sense of the confusion that is insurance and enrolling in it. At this time, I'm just going to share my screen once again so you all can see some of the reminders that we have here. Let me move on. So we have just some places here that refer to where you can go for help and what you can share with others. There is the Federal Navigator Program, and the website is there. And you can also go on Patient Advocate Foundation, patientadvocate.org. And Erin, you might be able to jump in here. I believe case managers can help if you are a patient with a diagnosis, right?
Correct. So a major chronic or debilitating health condition. I will just say, we're certainly able, keep in mind some of the deadlines and what we're trying to support you with, because our case managers, you'll get a needs assessment from a medical intake specialist, and then in return, receive a follow-up in typically 48 business hours. So I just want to put that out there because if it's something that's we would love to support you, but the earlier that you can connect with us. And then of course you have this large network of federal navigators too, specifically in Marketplace. And I think the variable here is, if Marketplace is really where your target is, then that's a great asset. If you are really trying to assess your other plan options and kind of a broader net, while we can still do the Marketplace, so please don't take that differently. It's just that, it's you might determine, or you might want to start with one and the other. So, but we also have some online resources, just like NPAF does. We actually kind of have them jointly there. But certainly, I think our biggest takeaway is please do seek guidance and help, especially if you don't feel comfortable, so that you can feel assured that the plans or the questions that you have are answered, so you can make the best choice for you.
Thank you, Erin. And so now I know, as you all are advocates, there's this drive to be like, okay, well, we're fired up. We have this information. What is it that we can do? And I have listed here just the different ways you can help right now. First is just to go on to npaf.org. Please download and share our ACA plan guide. It is a really great resource that, actually takes into account exactly what Erin says. We use worksheets to really hone in on what matters to you, like what doctors do you really like and what do you care about? What medications are you taking? What facilities do you want to go to? We have broken these down into easy worksheets that you can refer to, and we urge you all to share them with others as you are helping them to get covered. Mina alluded to this earlier. Tomorrow, you can participate in National Youth Enrollment Day. We will be sharing the toolkit. I see that Mina just dropped it into the chat. You can use that toolkit to help promote the resources for this open enrollment period. It also includes wonderful graphics that you can use to post on social media. We think, getting it out on social media is a really, easy way to touch as many people as possible. But, if you're also someone who would prefer to do that one-on-one help, you can do that too. And next week, we just want you all to continue to get the word out and to help your community get covered by January 15th. And we will also, let me see, I think we'll share the link to our plan guide in the chat as well as our follow-up resources. So you have that. We have just letting you all know here, it is our ACA Week of Action. We know this may have come as a surprise to many because it was just right smack dab after the holidays. But, if you didn't get to participate in the actions either Monday through Wednesday this week, totally fine. You can do that next week. Again, the last day to enroll in a Marketplace plan is January 15th. But if you remember any of the things that Mina or Erin emphasized today, it's important that people get enrolled as soon as possible. And that's really all we have today. If you have other questions, you are welcome to contact me, my counterpart, Mary McKira, who is our grassroots advocacy manager. Thank you all for taking the time to be with us today. We do have a short survey that will pop up as soon as we close out the Zoom. We invite you all to please fill out the survey, share your feedback with us. We always want to improve these presentations, and we can't do that without your feedback. So just want to take this time to thank our speakers. Again, Erin and Mina, you guys were amazing. All of the participants, thank you. And I hope you all have a wonderful rest of the day. Thank you.